All right, I'm going to try to do this little demonstration that we did in class for those of you that were at home and didn't get to see it. So I'm going to try to cut this in, and hopefully you'll just be wondering why I'm talking about it like that. So I got my spine, and I've got my orange crush, and I'm trying to discuss the proper body mechanics for lifting. And so this is a tool. If I've got a spine, sometimes I'll go get that, but I'm going to use my trash can here in a second, and I think that works just as well. But I'm going to show you guys how it works with the spine. So we're always talking about keeping our proper lumbar curve, our proper lordosis when we're doing these activities, and I want to show you a little bit about why that is. So I've already talked a little bit about all the wedging and drew all those bad pictures and stuff, but you can see, and maybe if I get even closer, you can see even better. Look at that. I've got my little wedges in here that are my little jelly donuts, and if I start to get too much lordosis, I can start to push, and I can make that my jelly donut filling want to come push out the front. Or if I get it opened up too bad, or if I start to rotate and flex and rotate, I can really cause a lot of pressure here. So we want that all in alignment. But you can see on this pelvis, when I'm looking at it, is that there's that pelvis wants to just naturally tilt forward a little bit. And maybe a little bit of tilt's okay, but when I get into excessive tilt, I'm going to start causing a lot more pressure here in my low back. And so why does your pelvis and my pelvis stay up is because I've got my abdominal muscles hooked to the front here. So I tell patients this is like having a big old bucket, and you think about everything that's sitting down in this pelvic cavity, all your guts, and if I've got a lot of extra abdominal fat, redundant tissue, that's all sitting in here, and it's all pushing this way, and it's all pushing this way, and I'm exaggerating now a lot, and it's pushing this way, and what happens is I'm going to start getting pain right here. And so where does most of my middle America back pain come from? It's usually not the back that's the issue. That's where the pain's going to end up being and where you're going to feel all the pain. But the issue is usually weak abdominal muscles. And so I need those abdominal muscles grabbing the front of my pelvis and doing their fair share of the work and load to hold this up, this pelvis up, so my back's not trying to do all the work. Because if my back is left to do all the work, it's like trying to hold a bucket from one side, and all that pressure is going to start to really wear here down in my low back and at my sacrum. So this is a great tool or technique, or this activity I'm getting ready to do is a great illustration for patients about why they need to keep their abdominal muscles strong, just in general, and why they need to set those muscles when they're doing lifting to try to protect that low back. So what I'll do in the clinic, especially if I don't have a model like that, is I'll get a trash can like this, and I'll maybe even put something in it, and I'll tell them, okay, your back now is, let's see if I can make this look better. And we'll see. My back now, this is my spine, and this is my lumbar spine, and this is my sacrum or my lumbar spine, and this is my pelvis, and this has got all my guts in it and my muscles and stuff there, and I'll give them this, and I'll hold it, and I'll tell them to just hold it like that. And how long do you think you can hold it like that? If I give them some weight in there, I'm trying to make this look so you can see it even better. You know, where are you starting to feel that pressure? You're starting to feel that pressure here, especially if there's stuff in there. So now what do my stomach muscles get to do? They get to reach over here and grab a hold and lift up that end. And so now I'm holding this from both sides, significantly less pressure on either wrist, which is, you know, on this side is my lumbar spine. So do that while you're watching this video. Do that in your room. Actually go find a bucket or a trash can or something, and maybe even put a little bit of weight in it, and see how much more difficult it is to hold at that end than to hold with both sides. So to me, that's one of the more effective little demonstrations your patients can do to try to help you teach them why it's so important to keep that core strong, just in general. You do a lot of walking, a lot of standing. I think I tell the story in lecture, usually at the beginning of the year, my back, I usually get a lot of low back pain, soreness just while I'm standing up here lecturing for an hour and a half, because I stand there and I already have a little bit of a natural anterior pelvic tilt, and then it wants to tilt more and more and more, and I get a lot of pain right here in my low back until I start doing my abdominal exercises again. I lose that couple of pounds I gained over Christmas or something, and get back into shape for doing that. So, you know, one of the big things that I usually talk to my just general low back patients that don't already have a functional structural issue that, you know, they've let it go so long, is that one of the best things you can do for just a general low achy back is keep your abdomen strong.